Hi, I'm Bruce Rideout, Head of Pathology for the San Diego Zoo and San Diego Wild Animal Park. In this series of tapes, we're going to be covering the pathology of zoo animals. I'm going to be starting with mammals, then we're going to move on to birds, and then I'll be concluding with amphibians and reptiles. I'm going to be, within each of those taxonomic groups, I'm going to be going by organ system. So I'll be starting with gastrointestinal diseases, moving on to respiratory, and then we'll conclude with the other organ systems. So let's start with the first slide. This slide is up here to remind me to tell you that most of the slides that I'm going to be showing you today are from the archives of the San Diego Zoo and San Diego Wild Animal Park, but I've gotten some great contributions from the National Zoo in Washington, D.C., as well as from Drs. Linda Lowenstein, Alan Pessier, Rebecca Papendick, and Brian Stacy. So I'm grateful to all of them for their contributions. So this is a Barbary red deer. First thing you need to notice is the ulcers around the oral cavity here. If you look closely, you'll also see some ulcers on the palate. Now, when you see something like this in an exotic animal, you need to be having the same kind of differential diagnosis you would have in a domestic animal. So you want to be thinking about blue tongue, bovine virus diarrhea, IBR, MCF, vesicular stomatitis, all of those kinds of things, with a few caveats. Although you want to have all of those on your differential, the vast majority of these cases turn out to be MCF. We rarely see disease associated with BVD or IBR or some of those other common domestic animal diseases. So be thinking about MCF. And remember, there's a whole handful of MCF viruses now. Alpha-lacking herpes virus 1 is the original wildebeest-associated virus from Africa. That's a foreign animal disease and is reportable. There's also alpha-lacking herpes virus 2, which was thought to be non-pathogenic until we had this outbreak in our Barbary red deer. This case happens to be alpha-lacking herpes virus 2. There's also the sheep-associated, and now the folks at Washington State have found several other gamma herpes viruses in this family, including one in goats and one in deer. So just be aware that all of them can cause a malignant catarrhal fever-like disease, and only one of them is reportable. That's AHV1. Another cause of oral ulcers in ruminants is fusobacterium infections. This is the dorsal surface of the tongue, and you can see a large ulcer where the mucosa has just sloughed back. And any kind of thing that can cause oral trauma can set up one of these infections. You can usually get fusobacterium necrophorum and several other anaerobes out of these lesions. So consider that in your differential as well. You're looking now at the hard palate of a Sumatran tiger. The nose end is up this way. The lesion I want you to see is right here. There are several smaller ones along here. And when you see an ulcerative lesion in the oral cavity of an exotic cat, you might want to have feline herpes virus and calicivirus on your differential as well. But this case turns out to be eosinophilic granuloma complex. Tigers are one of the only species we've seen this in, but it can occur in other exotic cats as well. So just be aware that those kinds of domestic animal syndromes can also occur in exotic animals. This is stomach from a warthog. The thing to notice is the partially digested blood on the mucosal surface. These are stress ulcers. Now, the interesting thing is if you look at these histologically, they're actually not ulcers, at least not in the early stage. The mucosa is still intact, but the tinctorial properties have changed. You get a washout of the staining color, and you can see blood actually effusing through the mucosal surface, and it comes out onto the mucosal surface and gets digested on the surface there. Now, any kind of thing that can stress an animal for prolonged periods can set them up for this kind of a problem. In this case, the warthog had chronic foot problems, was being immobilized repeatedly and treated for these foot lesions, and it eventually led to the development of these stress ulcers. This is stomach from a wolf guenon. It could be from almost any zoo mammal. When you see this kind of really dark hemorrhagic reaction all through the mucosal surface, the first thing on your differential should be a clostridial disease. In non-ruminants, we most often see Clostridium perfringens type A in these cases. In ruminants, it might be Clostridium septicum, the cause of braxy in young ruminants. We can also see Klebsiella infections associated with this. We can't say for certain that Klebsiella is the only cause in these cases, but very often the only pathogen that we can identify in these cases is a Klebsiella pneumoniae. This is stomach from a cheetah. Classic lesion. You really need to get this etched into your head. The mucosal folds are a little bit thicker than you would expect, and if you look at the highlights, you can see there's a very fine micronodular surface texture to the stomach. This is Helicobacter gastritis in a cheetah. Linda Munson and Karen Terrio have done some great work on this, and they've now identified at least 4 different Helicobacter species in cheetahs. There's one that's unique to cheetahs, Helicobacter acinetonyx, which is named after the cheetah. There's also Helicobacter felis. They found a Helicobacter pylori-like organism in these animals and a Helicobacter hillmanii. Now the interesting thing is they can find these Helicobacters in wild cheetahs as well, but the gastritis only seems to develop in the captive animals. So it seems as if there's some kind of complex factors that occur in captivity that trigger the response to these organisms and causes gastritis. But it's a fairly common lesion now in the captive cheetah population, so be aware of that one. Stomach from a young rock hyrax. Now it helps to know a little bit about normal anatomy. Rock hyraxes have a squamous portion of the stomach, kind of like horses do. And in the youngsters, that can set up a candida infection in that squamous portion of the stomach, especially in an orphaned animal, as this one was being hand-reared, can develop some stress problems, and they end up getting candida infections in the squamous portion of the stomach. This is stomach from a Cuvier's gazelle, abomasum. When you see thickened mucosal folds, kind of like we saw in the cheetah, but it's in a ruminant, first thing you have to think of is osteotagia. Trichostrongylus can also cause similar kinds of lesions, but you need to really have osteotagia high in your differential. If you don't see ulcers in the abomasum, you just see this kind of thickening, osteotagia is the first thing you want to jump on. This is a stomach from a Francois Langer. Stomach is up at this end. This is duodenum, going down in this direction. The thing you need to know about langurs is that they're leaf-eating monkeys. And every once in a while, leaf-eating monkeys do the unexpected, and they eat the stems in addition to the leaves. And the problem with eating stems is they have very long plant fibers in them that if they get twisted together, they can form a long rope-like foreign body, which is what you see here. So this is a string phytobezoar that formed when the animal started eating the stems of a mulberry browse bush that it was given as part of its diet. Once that gets lodged in there, it can cause erosions in the mucosal surface of the stomach and set up a secondary bacterial infection, as you see here. It can also erode right through the intestinal wall and cause a fatal peritonitis. So just be aware that leaf-eating monkeys can have problems with long plant fibers in their diet. This is rumen from an exotic hoofstock. The species doesn't matter. The thing to notice is that the rumen content is very frothy. Frothy bloat occurs sporadically in exotic animals. Every once in a while an animal will get an opportunity to get more of the rich components of the diet than they normally should. When that occurs, chemicals are produced that stabilize foam, prevents them from eructating the gas that's produced, and they can have serious problems. There's 3 potential fatal outcomes for frothy bloat like this. If the rumen just continues to expand, it can compromise respiration and the animal can die from respiratory compromise. As the rumen expands, it also makes the animals feel a little bit off, and if their enclosure mates detect that there's something wrong, they could be attacked by an enclosure mate. And the third thing that can happen is when they try to eructate some of that frothy material, they can essentially regurgitate and then aspirate and develop an aspiration pneumonia. So it can be a serious problem when it occurs. It can also cause rumen acidosis, which can then create big ulcers like this you can see on the serosal surface. Necrotic center, hemorrhage around the edge. Usually anaerobes are involved in these cases, actinomyces, fusobacterium, those kinds of things, and those organisms can then get to the mesenteric and periruminal lymph nodes and cause really nasty abscesses like you see here. This is intestines from a tamandua, a small anteater. Main thing you need to notice is the dark discoloration of the intestines. When you see that, only a couple of things you want to have high on your differential. One is an intestinal volvulus, which you should be able to easily rule out by just morphologic examination. The other possibility is a Clostridial enteritis. And again, in the non-ruminants, we typically see Clostridium perfringens type A in these cases. In ruminants, you can also see Clostridium perfringens type C and Clostridium difficile. So this is colon from a Kiang, an exotic equid. And the animal has a spontaneous rupture of the colon here. And the reason is because there's a large enterolith right there. We have a lot of enterolith problems in Southern California. May have to do with the hard water that we have and soil composition and that kind of thing. But the main signs you see clinically are just acute colic. Sometimes animals are just found dead in the morning, as this one was with the ruptured colon. The enteroliths tend to get lodged where the large colon narrows down into the small colon. So just be aware of that, a major problem in exotic equids in certain environments. So this is a Sumatran rhino. It's just been opened up. This is the cecum here, and this is the large colon here. And this is one of the most common causes of unexpected death in animals in the prime of life. It's a cecal volvulus. We don't know why rhinos in captivity seem to be predisposed to this condition. Sometimes they have sand impactions, and that can contribute. But most of the time it's just a spontaneous volvulus of the cecum. The classic sign is just massive hemorrhage all over the serosal surface of the cecum, and that extends all the way through the wall. This is a mountain paca. Now your eye might be drawn to the gallbladder up here. That's just enlarged because the animal hasn't eaten for several days. The main thing you should notice is the distended large intestine here. It's just distended with gas, but what you need to notice is the dark brown discoloration. This is hemosiderosis in a paca. It's not just a problem in birds. We also see iron deposition in certain mammal species. Lemurs are probably one of the biggest mammal species we have problems with iron. And remember, it's not a primary iron overload in the diet. Iron levels can actually be relatively low in the diet, and they can still develop this problem. And the reason is because they're very efficient at absorbing iron in the diet. In their natural environment, they encounter a lot of natural dietary items that bind iron and prevent absorption, so they develop very efficient mechanisms for absorbing it. So our challenge is to find iron-binding things that we can add to their diets to keep it at a minimum level. This is liver from a Przewalski's horse, an exotic equid. The lesion is up here, massive necrosis and hemorrhage. And the thing you want to think about with exotic equids, especially in Southern California, is Coccidioides immitis infection. It's a dimorphic soil fungus, primarily limited to the desert southwest, but because we move animals around for breeding all the time, you could see this in other parts of the country in an animal that had at one time been in San Diego. So just be aware of that. It causes necrotizing and granulomatous lesions in liver, lung, and can spread to skeletal muscle and almost any other organ system. So Coccidioides immitis in a Przewalski's horse. This is liver from a rock hyrax. Thing to notice are the white spots in the liver. You need to have a good differential for white spots in the liver of a variety of species. In this case, you're looking at Corynebacterium pseudotuberculosis. It causes pyogranulomatous and necrotizing lesions. Fortunately, it's not a common disease, but you need to be aware of it and keep it on your differential when you see large white spots in the liver. This is one of my favorite cases. This is the liver from an adult silverback male gorilla. And you notice these tan masses, multifocal decoalescing, extending throughout the hepatic parenchyma. This looks for all the world like neoplasia, and nobody could fault you for having neoplasia in the top of your differential, especially if you know the clinical history is just vague signs, being off food, weight loss over a period of months. But this turns out to be a free-living amoeba infection. This is Balamuthia mandrillaris. And we suspect the portal of entry is either through skin wounds, the oral cavity, or upper respiratory tract. And what's unusual about Balamuthia mandrillaris is that it can set up these extraneural infection sites. Most free-living amoeba go directly to the brain and cause fatal infections. Balamuthia can set up these fibrogranulomatous reactions that can go on for years and spread through the abdomen and thorax and look for all the world like a neoplastic process. Eventually, the organisms will get into the bloodstream and embolize to the brain, and then the clinical course tends to be very short, less than a week. You can typically find the organisms fairly easily in the lesions, but you have to be on the alert for them because they look a lot like macrophages. And you can distinguish Balamuthia from acanthamoeba by looking for double nucleoli. In the Balamuthia, they'll very frequently have 2 nucleoli in the organism. So this is Balamuthia in an adult gorilla. It's one of the leading causes of death now in great apes in captivity. This is liver from a brush-tailed batong, which is a small burrowing kangaroo from Australia. When you think about marsupials, think about immunosuppressive disease syndromes. Their immune systems don't seem to be able to respond well to some of the agents that they encounter in North American zoos. One of those agents is Mycobacterium avium, and that's what you're seeing here is a granulomatous response to Mycobacterium avium in the liver of this batong. This is liver from an aardvark. And again, neoplasia could be on your differential diagnosis, but it would help if I told you this animal was wild caught. In a wild caught individual, one of the things you want to think about when you see a lesion like this is cestode cysts, and that's what this turns out to be, is large expansile cestode cysts. Sometimes difficult to identify the cestodes down to a genus or species level, but sometimes you can do an acid-fast stain on them and identify the hooklets from the larvae, and that can help you identify the organism. This is liver from a cheetah, another classic disease you really need to be aware of. The dark depressed areas are areas of necrosis and parenchymal collapse. The lighter raised areas are areas of nodular regeneration. This is veno-occlusive disease in a cheetah. Nobody knows the cause of this, but it's relatively common in the captive population. The histologic lesion is fibrosis around the central vein, and then it progresses to cause hepatic necrosis, parenchymal collapse, and nodular regeneration. So it's a good board prep slide, too, because there's actually 2 things going on that you need to be looking for. When you see a really obvious lesion like this, you need to jump on it, but also look for other lesions. There are actually extrahepatic portal shunts here that have developed as a result of the liver disease. So always be on the lookout for multiple lesions in a single slide. This is liver from a Siberian weasel. Clearly the color is abnormal. You would never expect to see a liver of this color in an adult animal. And if you take a piece of this and put it in formalin, you'll see that it floats, and this is hepatic lipidosis. Same kind of condition you would see develop in a domestic cat or in a macaque in a primate center. Animals are typically obese to start with. Something puts them off food. They start mobilizing a lot of fat and sending it to the liver, and the liver can't package it up and move it out fast enough, and they get severe hepatic lipidosis and can die from this condition. This is liver from a Persian leopard, and the lesion is subtle, but if you look at the highlights, you can see that there's a fine micronodular surface texture to the liver. And this is chronic passive congestion from heart failure. And I guess the good news about a case like this is it reveals that we've got management of zoo animals worked out well enough now that a lot of animals are living to unnaturally old ages. And so we're starting to see a lot of geriatric conditions more and more often. One of them is chronic heart failure, and it can lead to chronic passive congestion in the liver, as you see here. Moving on to respiratory tract. This is the upper respiratory tract from a white-faced Saki monkey. Came into quarantine, was doing fine, then developed severe respiratory distress and just fell dead. When we did the necropsy, this is what we found. This is the larynx right here. The main thing to notice is massive edema and increased folding in the tissues surrounding the larynx. And that's what caused the respiratory distress. It occluded the larynx and caused the animal to suffocate. Now you might be thinking about anaphylactic kinds of reactions on your differential, and that's fine. But histologically, what we found was just loads of nematodes migrating through the mucosa here. And this is a gongylonema infection. This is a nematode that normally uses a dung beetle as an intermediate host, but in a captive environment, a life cycle can be set up with cockroaches. So what we think happened is at the other institution, this animal had picked up the infection, and then the stress of shipping and arrival in quarantine at our institution led to a more severe expression of the disease, and the animal died as a result of larval migration in the mucosa here and lots of edema that built up. So gongylonemiasis in a white-faced Saki monkey. This is another zoo ruminant. Could be any species. It may be difficult to orient on the slide. This is the larynx right here. You always want to be looking for landmarks in growth slides like this so you can orient yourself. That's the larynx. The lesion are these tan areas. This is necrotizing pharyngitis or oropharyngeal necrobacillosis. Anything that can cause oral trauma, again, can set up one of these infections. You have to also consider underlying viral infections that could predispose to something like this, IBR, adenoviruses, things like that. We've looked for these other viral infections and haven't found them in these cases. What we think happens is sometimes animals go out and find coarse hay that's been scattered around in the ground. They pick it up and may have some fecal contamination in it that has fusobacterium, especially if there's been a rain recently that can help allow the organism to proliferate. And then you can get a really nasty oropharyngeal necrobacillosis, and we can even see outbreaks of this in our animals. This is trachea from a koala. Remember I mentioned, think about immunosuppressive disease syndromes when you see marsupials. The lesion is this mass right here in the trachea. Kind of has a gelatinous appearance. That may be a tip-off. This is cryptococcosis in a koala. This is an old world primate, a Duke Langer. An interesting anatomical feature of old world primates is many of them have air sacs. What you're looking at is the neck, ventral neck region opened up. These are mandibular salivary glands here. And if you look, you can see there are very deep air sacs here. The reason why these animals have air sacs, physiologists think, is that it enables them to engage in very loud, rapid vocalizations without hyperventilating. They can store a lot of air in these air sacs and then use it for vocalization. The problem is you can get bacterial infections developing in these air sacs, and that's what this white material is. It's a suppurative exudate in the air sac. This is suppurative air saculitis in a Duke Langer. Typical agents that we'd find in these would be all your favorite gram-negatives, E. coli, Klebsiella, Pseudomonas, those kinds of organisms. So suppurative air saculitis in an old world primate. This is lung from a pygmy chimpanzee. The lesion is these darker depressed areas. This is a diffuse interstitial pneumonia. When you see interstitial pneumonias in the old world primates, especially the apes, you want to be thinking about the human respiratory viruses. They're very susceptible to them. This turned out to be a case of human respiratory syncytial virus in this chimpanzee, a fatal case. We try to keep these animals as isolated as we can from the visiting public and from our keepers, but every once in a while there's a breach in the biosecurity, and an animal can get exposed to one of these human respiratory viruses. So think human respiratory viruses with ape interstitial pneumonias. So this is lung from a gazelle. What you need to notice are the multifocal to coalescing tan areas in the lung. This is pyogranulomatous inflammation. And there's a number of things you could have on your differential, including Mycobacterium avium, some other things I'll be showing you in just a minute, but this case turns out to be Rhodococcus equi. Same kind of thing you'd see in domestic animals can occur in our exotic animals. It's an important management concern because carriers can develop. If they shed the organism in the environment, it can get kicked up in dusty soil and you can end up with serious pneumonia problems, as we see in this case. This is a musk deer, similar lesion but more solitary. This is the lesion right here, tan focus on the cut surface of a lung. In this case, it turns out to be cryptococcosis. So again, you want to be having a broad differential in zoo animals. You don't want to just think of the most common agents. You always want to be thinking about opportunistic infections like cryptococcosis. So this is lung from a Japanese Serow. It's another exotic hoofstock. Similar lesions to what we've just been seeing, multifocal decoalescing tan lesions in the lung. In this case, it's a mycobacterium infection, atypical, Mycobacterium kansasii. So again, keep a broad differential. When you see these kind of granulomatous to pyogranulomatous lesions, it's a good idea to freeze things at necropsy so you can do additional diagnostics later on, but keep a broad differential. So this is lung from tiger quoll, another marsupial, and the lesion is this consolidation in the lung here. And again, marsupials, think immunosuppressive disease conditions. This is a Mycobacterium smegmatis infection. Now, ordinarily you wouldn't think of finding that agent in an ammonia, but you can. We've even seen mycobacterial pyometras in marsupials. So just be aware they've got a big problem with mycobacteria. Think atypical mycobacteria in marsupials. So this is lung from a weasant, large bison-like animal. One of the problems with really large hoofstock in field enclosures in zoo settings is that it's very difficult to immobilize them for any medical procedures. When they do get immobilized, there's a high risk of regurgitation and aspiration at some point, either during or after the procedure, and that's what you're looking at here is aspiration pneumonia, maybe 5 to 7 days after a procedure was done. You get a lot of different organisms in these lesions. You can even see green fuzzy fungal growth in some of these airways. So when you see cavitary lesions, really nasty smelling things in exotic hoofstock, think aspiration pneumonia. Find out when the last immobilization was done on the animal. That might be your tip-off. Another tip when you're examining these histologically is if you examine the lesions under polarized light, the little plant fibers are birefringent. Helps you to pick them up more easily and confirm that it's an aspiration pneumonia. Lungs from a New Guinea singing dog. Now, the thing to notice in this case is that the lungs are not collapsed. They're really hyperinflated. If you were able to squeeze those lungs, they'd be very rubbery and firm, so they haven't collapsed. And that's a classic appearance for acute respiratory distress syndrome. And as you know, there's a huge long list of things that can trigger this condition. We never did figure out what triggered it in this case, but just be aware that these kinds of things happen in exotic animals, and you want to have the same kind of differential. Any kind of bacterial septicemia, viral infections, pregnancy, all kinds of things can trigger it. This is lung from a Duke Langer. This is pleural surface over here, cut surface on this side. What I want you to notice are these bronchioles are a bit more dilated than you would normally expect. There's a lot of white fibrous connective tissue around the edge of the lesion. And there's also dark pigment in between. And that's classic for a lung mite infection, pneumonisis species. We don't see this so much in our collections anymore. It's mostly been cleared, but every once in a while we get imported animals from outside the country and they can have these lung mite infections. Usually they carry it without major problems, but it can cause fatal infections in some cases. This is the thoracic cavity from a Reebok, another exotic hoofstock from southern Africa. Thing to notice is severe fibrinous pleuropneumonia. Lots of fibrin strands throughout the thoracic cavity, lots of fluid accumulation. Normally we think of filamentous bacteria when we see this kind of thing, actinomyces, that kind of thing. You always want to be thinking though about other underlying conditions, either a viral infection or a mycoplasma. In this case, it turned out to be a mycoplasma, one that had never before been characterized. In this case, it fell into the Mycoplasma mycoides group, which includes some foreign animal diseases, so we had to involve USDA in our investigation. Turned out not to be a domestic animal pathogen, but does appear to be pathogenic in our Reebok. Now, what we suspect happens in some of these cases is there may be asymptomatic carriers somewhere in a zoo collection, and when an animal gets exposed for the first time, as these Reebok did, then it can cause severe disease. So mycoplasma, pleuropneumonia in a Reebok. This is lung from a Przewalski's horse. Remember I showed you the liver earlier, had coccidioides immitis infection. You want to be thinking the same thing when you see a lesion like this in the lung. Large pyogranulomatous inflammatory lesion, think coccidioides immitis. Another tip, just remember that the infective stages are in the soil. It's unlikely that you would ever pick up an infective stage from a tissue lesion like this, so the main concern is soil for human infections. So coccidioides immitis in a Przewalski's horse. This is lung from a black rhinoceros. The lesion may be kind of hard for you to pick out, but it's actually well demarcated. This is one edge of it here, another edge over here. This is a large area of pulmonary necrosis due to aspergillosis. We actually see aspergillosis sporadically in black rhinos, especially in the lung. One of the conditions that can predispose to this is they get a vesicular skin disease that's of unknown cause, but requires that they be put on long-term antibiotic therapy. And when they're on antibiotics long-term, then they can get secondary fungal infections, and that's what happened in this animal. Aspergillus pneumonia secondary to long-term antibiotic therapy. This is a great slide. You're lucky when you find this kind of lesion. Every once in a while, an animal will just drop dead unexpectedly. Nobody knows why, and everybody turns to the pathologist to get help in figuring out what happened. All too often in those cases, we never find a lesion that would explain why the animal died suddenly. But sometimes you get lucky and you find a large pulmonary thrombus, as we found in this animal. The kinds of things that predispose to pulmonary thromboemboli like this are giving birth. Females will sometimes develop this 1 or 2 days postpartum. And prolonged surgery, if they're down on a table for a long period of time or down on the ground for a procedure, that can predispose to the development of pulmonary thrombi. So we found that the best way to find these things is to bread loaf the lung, not to try to dissect out all the blood vessels. So do a lot of bread loafing, look for pulmonary thrombi when you have a sudden death case. Kidney lesions. 2 ways that pathogens can arrive in the kidney. One is ascending the urinary tract, the other is by the bloodstream. And this is an example of hematogenous embolization of bacteria in the kidney of a gazelle. And this is Actinomyces pyogenes. It's an organism that's relatively common in the environment. Animals get skin wounds and things that can allow a portal of entry, and those organisms can then embolize to places like the kidney. Another example of embolic nephritis. Remember that the blood supply to the kidney, a lot of those vessels are coming in around the corticomedullary junction. It's a good place to see these hemorrhagic lesions from an embolic nephritis. In this case, it was a gram-negative septicemia resulted in these embolic lesions in the kidney. Now when you look at this, you might be thinking a pyelonephritis. If you look at the tip of the renal papilla, there's some involvement there, and then the lesions seem to be radiating out from there. This is actually an embolic nephritis. The tip is the hemorrhage that you see right at the corticomedullary junction. That's where the organisms are arriving. This is a staph infection. And then the blood vessels track down the medulla towards the papilla, and so the inflammatory response follows it. So this is actually an embolic nephritis due to a gram-positive staph in this case. This is a slide from the National Zoo, a bush dog. What you're looking at are the kidneys on the cut surface and the aorta. Now this should be a giveaway. If you get a slide like this on the board exam, take it as a gift. This is icterus in the aorta, very dark kidneys from hemoglobinuric nephrosis, and this is a leptospirosis case. I don't recall what serotype was involved, but presumably it was Canicola. So just be aware that in some parts of the country, leptospirosis occurs in zoo animals and can cause hemolytic anemias like you see in this case. Acute renal infarcts, easy to identify. The trick is finding out where they came from. In this case, the animal had a placentitis, and we think the organisms embolized from there and caused this acute renal infarct. Another common portal of entry for for bacteria in these kinds of cases is umbilical infections in neonates. This is kidney from a cheetah. Lesions are these tan to white areas in the cortex. This is feline infectious peritonitis. Think the same kind of things you would think in a domestic cat. See those kind of lesions in a domestic cat, you ought to be thinking FIP. Lymphomas are much less common in our collection experience, so be thinking FIP in a cheetah. Again, as I mentioned before, animals are living really long lives now in zoos, and so we see a lot of end-stage organ failures. This is chronic interstitial nephritis in a loris, a small prosimian, and you can see depressed areas in the parenchyma from scarring and parenchymal collapse. Very severe case of chronic interstitial nephritis. We almost never find the cause at this late stage. Just be aware that it's not an unusual finding in some species. This is a beautiful slide. I love this one. You're looking at a cross-section of the kidney. This is the ureter down here, caught in cross-section, surrounded by necrotic saponified fat. So what happened is the fat underwent necrosis, compressed the ureter. That caused urine to back up and create hydronephrosis. So now the question is, what caused the fat to become necrotic? A couple of things. First of all, it typically happens in obese animals. It can happen just spontaneously in cases we can't find the cause of. But also be aware that fescue grass often has a fungus associated with it, claviceps, that produces a toxic alkaloid that causes vasoconstriction. So if animals are grazing on fescue pasture, it can cause vasoconstriction resulting in necrosis of fat, and this can be the result. If the fat is in the pelvic canal of a female, you can also have severe dystocia develop. Animals can even die trying to deliver their babies because they can't get them through the birth canal because it's blocked with necrotic fat deposits like this. Kidney from a gazelle. Classic lesion. Better be able to recognize this one. The main thing is the streaking in the medulla. You also notice some cortical collapse and interstitial fibrosis. This is the tip-off right here. The renal papilla has become necrotic and sloughed off. So you have renal papillary necrosis, and this is all due to renal medullary amyloidosis. There's a lot of amyloid deposition in the medulla. Tends to occur there much more often than in glomeruli. And when it happens there, it can compress blood vessels, compromise kidney function, and you end up with a lot of secondary changes and ultimately leads to renal failure. This is urinary bladder from a mouflon, sheep. And you'd want to be thinking about the same kind of things that you would in domestic sheep. This is a male who developed a urinary calculus and ended up getting obstructed and had a rupture of the urinary bladder. This is a big blood clot right where the site of the bladder rupture was. Now, if the animals have a lot of phosphate in the diet, they can develop struvite stones. If they're on pasture, more often silica or oxalate stones. Sometimes it's really hard to find the stones and get them out for analysis. So just be aware that same kind of thing you can see in domestic sheep, you can also see in exotic sheep. This is one of the few neoplasias I'll be showing you. Most of the time, neoplasias look the same in exotic animals as they do in domestic, so I don't need to show you a lot of those. But when there are particular neoplasms that are common in zoo animals, I want to point them out. This is bladder from a fishing cat. There are several mass lesions, one here, one down here near the trigone of the bladder. And then there's also a thickened mucosal surface throughout the rest of the bladder with secondary hemorrhage and inflammation. And this is a transitional cell carcinoma. We don't know why this is so common in fishing cats, but roughly 2/3 of the animals that we've had come to necropsy have had transitional cell carcinomas. So just be aware of that. Hematuria is the main clinical sign. Moving on to reproductive tract lesions. This is the uteruses from a koala. Now remember, marsupials have cloaca with 2 vaginas, 2 cervixes, and 2 uteruses. So everything's duplicated. So don't call these right and left uterine horns. They're actually separate uteruses. And this one is opened up here. You can see there's a pyometra. It's actually a relatively uncommon lesion in zoo animals, but I wanted you to be aware of it. And as I mentioned before, you can get any number of different organisms out of these lesions. Sometimes you can even get mycobacteria. This is endometrium from a leopard. And if you look carefully, you might notice the fine micronodular surface texture to the endometrium. This is cystic endometrial hyperplasia. It can occur spontaneously, but if the animal has a contraceptive implant, melengesterol acetate implant, then they tend to have an increased incidence and increased severity of cystic endometrial hyperplasia. It's not a primary cause, but it does increase the incidence and severity. So just be aware of the association between those contraceptive implants and cystic endometrial hyperplasia. Interestingly, we very, very rarely would see pyometra associated with this. So it's primarily just the cystic change. If it goes on long enough, it could compromise reproductive capabilities. So if an animal is valuable for breeding, we don't keep them on these contraceptive implants for too long. This is uterus from a rock hyrax. Thing to notice is the hemorrhage on the surface of the uterus. This is the uterus down here. In any number of exotic species, you can have Clostridia getting through the cervix postpartum and setting up a nasty gangrenous metritis postpartum. We see it more often in ruminants than other species, but it can occur in any number of zoo animals. So gangrenous metritis postpartum. Another danger in pregnancy is uterine torsion. This kind of looks like it could be a gangrenous metritis, but the fetus is still in the uterus. And what's happened is there's a torsion right around the base of the uterus here, cut off all the circulation, ended up killing the mother and the baby. So uterine torsion in a Gemsbach. This is the preputial region of a warthog. Very interesting lesion. We've seen several cases of this. Gangrenous necrosis around the prepuce. What we think the cause might be is impaction of preputial glands that occludes the preputial orifice. The animals then urinate inside the sheath and end up getting these really nasty secondary infections that just causes complete necrosis of the preputial area. This is the penis here. This is all the surrounding tissue that's completely necrotic. So watch out for preputial gland impactions in male warthogs. Vagina from an elephant, African elephant, adult female. This is all mucosal surface of the vagina completely covered by huge coalescing polyps. We don't know what the cause of these polyps is, but it tends to be relatively common in middle-aged females who haven't been bred. And there hasn't been that much breeding in the African elephant population in captivity in the last 10, 20 years, mainly because it's really hard to maintain breeding males. But in any event, once this is set up, this animal is essentially out of the reproductive pool. It would be very difficult for her to conceive and give birth because the vagina is almost occluded by these vaginal polyps. Cystic ovaries occur primarily in geriatric situations. This is a hairy-footed hamster. The ovaries are almost completely replaced by these cysts. And we can see, sometimes at this stage, it's hard to figure out if it's a follicular cyst, a luteal cyst, or a para-ovarian cyst. But the main thing to be aware of is we rarely see reproductive problems associated with these ovarian cysts, mostly a geriatric incidental finding at necropsy. For males, again, it's mostly geriatric lesions in the reproductive tract. These are testes from a Russian saiga, and the white areas that you see are areas of necrosis and mineralization, just an old age degenerative change in the testes. Looking at a couple of placenta lesions, before I describe this one, it's an opportunity for me to remind you or tell you about a great resource that's on the web now. Dr. Kurt Benershka has a website on comparative placentology. He describes all the different types of placentas and different species, and even includes some disease conditions in placentas. The web address is kind of complicated, so I'll just tell you, do a Google search for comparative placentology, and the first thing that should come up is his website. It's a great resource. So this is placenta from a rock hyrax. They have a zonary placenta. But regardless of the placental type, you shouldn't have this thick layer of fibrinonecrotic debris on the surface of the placenta. In this case, turned out to be a Listeria placentitis. It doesn't occur too often, but when it does, it's a problem for us. There's avenues of introduction of Listeria through diet and environmental conditions that we want to make sure we stay on top of. So be aware that Listeria can cause placentitis in a lot of different species. This is an Indian rhino placenta. The lesion should be obvious. These tan necrotic areas with hemorrhage around the edge. Don't jump to the conclusion, though, that these are highly significant. You have to correlate the gross appearance with histology and the outcome of the birth process. And in this case, this is an incidental finding. Blood vessels are undergoing thrombosis as a natural process of delivering the placenta and the baby. Sometimes you just get these necrotic foci surrounded by hemorrhage. There's no organisms in there, but you have to do the histopath to find out. So incidental placental necrosis in an Indian rhino. Few endocrine lesions. This is the pituitary from a Przewalski's horse. Very large pituitary, same kind of condition you'd see in a domestic horse. This is an adenoma of the pars intermedia. Produces the same kind of compounds you'd see in a domestic horse. The animals get a very hairy coat and classic appearance, adenoma of the pars intermedia. One of the more common endocrine conditions we see is congenital goiter in ruminants. This is a Barbary red deer, very large thyroids for a newborn. A couple of things that can predispose to this are iodine deficiency or iodine excess in the dam. You could also theoretically have a defect in thyroglobulin synthesis, although that's really hasn't been documented well in exotic animals. So just be aware, 3 possible mechanisms for congenital goiter. In much older animals, we sometimes see these cystic follicles and then areas of follicular collapse and hyperplasia. Haven't really attached much functional significance to these changes. Seems to be a geriatric thing. In this case, a very old black rhino. Parathyroid hyperplasia is not usually seen now as a primary nutritional problem. It usually occurs secondary to a renal disease, severe renal disease, and you get bilateral parathyroid hyperplasia. This is a great case. Look at this for a second. I'm not including too many congenital defects just because same kind of congenital defects you might see in domestic animals you can see in exotic animals as well, but this one is a classic. It could be a good board slide. I included the ruler and the number down here just so you'd be sure that this slide hasn't been inverted. This is a case of situs inversus in a Corsac fox. Notice the stomach is on the wrong side. So over here on the right should be on the left. Same thing with the spleen. So all the organs have been reversed in this case, situs inversus. The animal was born alive, seemed to be doing fine, and died from unrelated causes, actually. Heart lesions. One of the most significant heart lesions we see in zoo animals is vegetative valvular endocarditis. Usually gram-positives are in these things, staphs and streps. And if you look hard enough, you can usually find a skin lesion or some other source for the bacteria to get in and cause an intermittent bacteremia that sets up the valvular infection. So valvular endocarditis. This is heart from a black rhino. The lesion is these pale areas in the heart. This is embolic aspergillosis. Same case that I showed you the lung on earlier. Again, if they're on long-term antibiotic therapy, they're predisposed to aspergillus infections and they can embolize all through the body. In this case, it landed in the heart. So aspergillus myocarditis. If an animal has a chronic or intermittent bacteremia, they can develop a chronic fibrinous pericarditis like you see here. Can see any number of organisms, gram-negatives as well as gram-positives in these cases. So you want to be on the lookout for a nidus of infection that might be causing a chronic or intermittent septicemia when you find a lesion like this. Dilative cardiomyopathy is something we see occasionally, mainly in older animals. This is a wolf guenon. And we don't really have a good handle on predisposing causes. We do see this more commonly in some small mammal species, and so we're working on the possibility of taurine or carnitine deficiencies in some of these cases, but haven't been able to confirm anything yet. So this is just a idiopathic dilative cardiomyopathy in a wolf guenon. When you see an atrial thrombus, like we have here, be thinking about cardiomyopathies. And if you have a cardiomyopathy, look for an atrial thrombus. The two tend to go hand in hand, so it's a good, if you find an atrial thrombus, step back and see if you have evidence of a dilative cardiomyopathy. This is aorta from an adult male gorilla. Hopefully you can see the lesion, a dissecting aneurysm around the aorta. Don't know the cause of this. Doesn't seem to be a copper deficiency weakening the wall. Could be just a situation of overweight animals, sedentary lifestyle, and maybe some sources of stress in their captive environment that contributes to these kinds of things. But idiopathic aortic aneurysm in a gorilla. Can also get arteriosclerosis with resulting thrombosis in primates. This case turns out not to be atherosclerosis. I've got some other examples of that later on. But arteriosclerosis, idiopathic, sometimes you can find evidence of hypertension. Most of the time you never find a cause, but it can be significant when it causes thrombus like that. This is hemopericardium in a sea lion. Want to think about trauma as a possible cause, but also there can just be a spontaneous rupture of the heart or a great vessel. A lot of times we don't find the site of rupture. In this case, we got lucky and there was a big clot in the aorta where the rupture had occurred. Again, we can't find any evidence of copper deficiencies or other things that would weaken the wall of the aorta. It just occurs spontaneously. Hypertrophic cardiomyopathies we also see occasionally in a variety of species, not associated with hyperthyroidism for the most part. So again, an idiopathic condition. Another thing we see occasionally that's an idiopathic condition is myocardial mineralization. I see this mostly in Mexican red brocket deer, a few other ruminant species. The main thing to look for is white areas in the wall of the heart, myocardial mineralization. We've looked for toxic plants and other things, haven't been able to find anything. And this is a great slide because there's two things going on. Your eye might immediately be drawn to the septal defect down here, but there's also a patent ductus arteriosus up here. So it's a good thing to look for two lesions in slides on the board exam. And remember that in ruminant species especially, that ductus arteriosus can remain patent for several days after birth, but it'll completely close down and be occluded by 7 to 10. This is a classic slide. I love this. It's one of my favorite slides. This is back from my early days at the National Zoo, and I'm grateful that they enabled me to use this slide. This is a juvenile red panda presented with some vague clinical signs, was being given supportive care in an incubator, and was found dead the next morning exactly in this position. And I guess the only reason why I'm showing you this slide is it's a good reminder that rabies always sneaks up on you. Very often we're just not thinking about rabies in zoo animals, but it can occur. In this case, there was an outbreak of rabies in raccoons in the Maryland and DC area at the time, and the suspicion was that this animal had an aggressive encounter with a rabid raccoon at a fence line that nobody knew about. There were no visible bite wounds or anything, but it subsequently came down with rabies. You'll typically find plenty of negri bodies in the brain in these cases, but you always want to submit them for immunofluorescence to confirm the diagnosis. So this is rabies in a red panda. This is a cross-section of brain showing a really severe necrotizing encephalitis. We see this most often in youngsters with umbilical infections. The bacteria can then embolize to the brain, and that's what happened in this case. You get a very severe necrotizing and suppurative encephalitis. Typically gram negatives involved in these cases. A more mild version of this suppurative inflammation, you might just see hyperemia of the leptomeninges when you have a suppurative leptomeningitis. A good thing to do when you see something like this and you're wondering whether it could be a leptomeningitis is to turn the brain over and look around the base of the brain. If there's any pus, it'll accumulate there first, and that's suppurative leptomeningitis due to septicemia. This is in a young hoofstock. This is a great case. This is a juvenile okapi, and I hope you can recognize cerebellar coning and herniation here. What was neat about this case is that the animal had a fairly long history of vague neurologic signs. We couldn't figure out what was going on. We actually brought in an MD radiologist and a portable MRI unit to do an MRI on this animal. And the MD radiologist said he couldn't find any lesions after doing the MRI. And Dr. Linda Lowenstein, who was our head of pathology at the time, looked at the images and told the radiologist she thought there was deviation of the midline of the brain and that there was a mass effect in the cerebrum. And the MD said, no, that's just an artifact of the metal bands in the endotracheal tube are causing distortion of the image and so on. Well, it turned out the animal died a couple of days later, and Linda was right. There was a mass in the cerebral cortex right where she thought there was, and it turned out to be an aspergillus embolism to the brain. Don't know why this animal was predisposed to aspergillus infection, but it was. Chalk one up for the veterinary pathologists in this case. Now, I showed you earlier a liver from a gorilla that had a Balamuthia infection, and this is what it looks like when Balamuthia gets to the brain. You'll get these hemorrhagic and necrotic lesions in the brain. Histologically, there's granulomatous to pyogranulomatous inflammation and typically large numbers of amoeba. So it's not hard to make the diagnosis as long as you know how to recognize the amoeba. And again, you can identify or usually distinguish Balamuthia from acanthamoeba by looking for the double nucleoli that you'll see in Balamuthia. This is brain from a cheetah. Very important condition. Be aware of this, especially for a board exam. Look at the white matter tracts. If you look carefully, you'll notice that there's a loss of the normal white color, kind of more tan areas in some of these white matter tracts. This is leukoencephalopathy in a cheetah. We don't know the cause of this. It's a disease that's emerged over the last 5 years or so, mostly in older cheetahs, 7 years of age or older. The clinical signs are ataxia and blindness. It's generally progressive. Animals rarely would survive this. And the cause is unknown, as I said. A lot of things have been speculated on. Some people think it has to do with vaccination. Some people think there was a contaminated diet. Some people think it may be Helicobacter gastritis producing autoantibodies that then limits vitamin B synthesis, and that could be contributing to this. In any event, nobody really knows the cause, but be on the lookout for these white matter tract lesions if you're shown a cross-section of cheetah brain. Ventral surface of the brain of a small primate. Thing to notice is one of the basal arteries is massively distended by a thrombus, and in this case there was pre-existing atherosclerosis. And we don't see atherosclerosis that common in zoo animals. The conditions where we do see it are older animals. Before we got smart and hired nutritionists at zoos, it was very common to feed a lot of hard-boiled eggs to some animals because the egg whites are such a good source of protein. It never occurred to us to take the yolks out, and so the animals were also getting whopping doses of cholesterol while they were getting those good proteins. So in those cases, very often the animals develop atherosclerosis and can subsequently develop a big thrombus, as you see here. Now this is an important one, important lesion in newborn primates. Skull cap has been removed. You're looking down on the dorsal surface of the brain. In this case, it's a Kikuyu colobus monkey. Two different types of hemorrhage you want to be aware of. If you lift the skull cap off and there's blood there that you can scrape off with a knife, that is subdural hemorrhage, and the cause is typically trauma. If you have hemorrhage under the leptomeninges, as you see here, all this blood is under the leptomeningeal surface. You cannot scrape that off with a knife. It's under the surface of the brain there. The typical cause of that is hypoxia during birth. So make sure you distinguish those two different types of hemorrhage. Subdural hemorrhage is trauma. Subleptomeningeal hemorrhage is typically hypoxia. One of the only things you would commonly see with a severe case of hyperthermia is severe hyperemia of the brain. So that's the main thing to show you here. Every once in a while, conditions can arise in which an animal would get hyperthermic. Be aware that the main thing you're going to find is hyperemia of the brain. There aren't many other lesions you would normally see with this condition. Sometimes autolysis would be more advanced than you would expect for the postmortem interval, but otherwise look for severe hyperemia of the brain if you're suspecting a case of hyperthermia. Eye lesions. This is suppurative keratoconjunctivitis in a Barbary red deer. Probably the most common situation in which we see this is ocular trauma and a secondary bacterial infection, but you always want to have things like MCF on your differential, and this is another Barbary red deer with malignant catarrhal fever, in this case alpha-lacphine herpes virus 2. And be aware also that this can cause, HV can cause unilateral keratoconjunctivitis. It doesn't always have to be bilateral. So even if you see it in just one eye, keep MCF on your differential. Another age-related thing we sometimes see is cataracts or lens luxations from old trauma. And that's what you see here. This really opaque lens is a luxated lens in an exotic hoofstock here. Old trauma was the cause. Moving on to hemolymphatic system. When you see this kind of cheesy exudate in a lymph node in a large zoo hoofstock, you want to be thinking about Mycobacterium bovis and the M. tuberculosis complex. This is a Bactrian camel from the National Zoo's Front Royal Center. Many, many years ago, there were some M. bovis cases there. And this is just the classic appearance of it. So be aware. Lots of other differentials. You want to be thinking about actinomyces and other things. But first thing you got to do is do a quick smear, get a mask on if you're doing a necropsy on one of these cases. M. bovis in a Bactrian camel. This is a tree kangaroo. Remember, when you're thinking about marsupials, think about more immunosuppressive conditions. This mesenteric lymph node has M. avium in it, not anything like M. bovis or M. tuberculosis. So Mycobacterium lymphadenitis in a marsupial. Here's more of a classic anaerobe infection in the spleen. You notice the rumen is right here. What we think happens in these cases is there's rumen acidosis, creates a rumen ulcer, perforates, the spleen adheres to it, and the bacteria can then penetrate the spleen and cause these really nasty necrotizing and suppurative inflammatory lesions with filamentous bacteria. Cheetah, this is a cheetah spleen. When you see white nodules in the spleen of a cheetah, don't think lymphoma, think myelolipoma. These are nodules of fat that have bone marrow elements in them. It's very common in the cheetah, classic thing. Be on the lookout for that. It's incidental, doesn't cause any problems in them. This is about the only normal anatomy slide I'm going to show you. This is thymus in a wallaroo. Notice two lobules, the ventral neck outside the thorax. The reason why it's important that you know this location is that thymic lymphomas are common in some species of marsupials like the koala. And this is a thymic lymphoma. You're looking at the same region, two very enlarged thymic lobules here. And when these were originally described, people thought these were cervical lymph nodes because they didn't know where the thymus was located. These are actually thymic lymphomas, so just be aware of where the thymus is in many of these marsupials, outside the chest and the ventral neck. Musculoskeletal diseases. One of the most frustrating that we deal with is mandibular osteomyelitis. You can see a large cavity in the mandible of this ruminant, suppurative inflammatory exudate in the middle. Probably a number of situations can set up an infection like this. The problem is once it's there, we've got a great dentist who's tried every means that he can think of to treat these things, and they always seem to be progressive. Eventually the animals die from this. So A very frustrating problem. This is long bone from a tree kangaroo. I hope you're getting the message by now. You see white areas like this. Think Mycobacterium. This is a mycobacterial infection in a tree kangaroo. The folks at the National Zoo, Dick Montali, has done some really interesting work on this mycobacterial problem in tree kangaroos, and some molecular epidemiology work that they've done seems to indicate that most of these animals pick up their infections from the environment. They're not transmitting it horizontally from one animal to another. That has important management implications for us because it means that we can then safely pair up an infected animal with an uninfected animal for breeding and not have to worry so much about transmission of the infection. But in any event, just be aware they're extremely sensitive to M. avium. They pick up those infections from the environment very easily. This is a cross-section through the skull of a koala. You should be able to recognize the olfactory lobes of the brain right here, frontal sinuses just above, and nasal cavity down here. The lesion is this thickened area of bone next to the nasal cavity. And this is osteochondromatosis in a koala. It's not an unusual condition. We see it sporadically in our collection, and if we do EM on these, we can find budding retroviruses. So we think this may be a retrovirus-induced condition, much like the osteochondromatosis that's been seen in the past in cats with FELV infections. So be aware this exists in koalas. The histologic lesion is just benign bone and cartilage proliferation, but it is progressive, and it tends to occur in the skull and spread all throughout the skull. It's hard to control. Animals eventually die from it. This is a carpal joint from an African elephant. And as I mentioned, as zoo animals are managed better and better, they're living longer and longer lives, sometimes unnaturally long lives. And one of the things we see more and more often in older animals is degenerative arthritis or degenerative joint disease. There's a lot of cartilage erosion and fibrillation and eburnation here. Things that can contribute to this are inactivity, unnaturally hard substrates, and obesity. So it's really a management thing that we're trying to control, but age adds on to the severity of it. This is the diaphragm from a young zoo hoofstock. It's a disease we don't see much as a primary disease process anymore, but you still need to recognize it. White muscle disease. Areas of necrosis and mineralization in the diaphragm. In this case, it's not a primary dietary deficiency of vitamin E and selenium. This animal had a chronic Cryptosporidia infection that caused diarrhea and malabsorption, and that was the primary problem in this case. So white muscle disease secondary to malabsorption syndrome. Skeletal muscle from an exotic ruminant. Thing to notice is the mottling, dark red here, tan next to it, and the dry appearance of it. You notice there's not a lot of moist highlights on this. It's because the tissue is a bit dry. Be aware that the gross appearance of muscle can be very deceiving. Blood pooling can create all kinds of mottling and make it look like there are lesions there when really there aren't. We've seen cases of exertional myopathy with no gross lesions, and we've seen some spectacular gross changes that we thought were going to be exertional myopathy, and they weren't. This case turned out to be exertional myopathy. Good case of it. The dryness is one of the tip-offs. It's a good slide as a reminder to those of us working in zoos that there are hazards associated with doing necropsies on zoo animals. Most of the large ones have to be immobilized with darts from a long distance. Sometimes those darts break off in the muscle. If the animal dies during the immobilization procedure, there could be very powerful narcotics still in the needle of this dart. So our veterinarians are very good at alerting us if they've darted an animal and have lost the dart needle. So be aware that's a risk if you're doing necropsies on zoo animals. I'm not going to show you too many congenital deformities, but this is one of the more common ones, arthrogryposis. We see this spontaneously, especially in highly inbred populations. We've looked hard for bunyaviruses and toxic plants and some of the other things that can cause these conditions and haven't found them. Seems to be a relatively common spontaneous condition in some inbred populations, so just be aware of that. This is one of the cooler congenital anomalies. This is a mouflon with 6 legs. The only reason why I show you the slide is so that you know the term for this. It's polymelia. You know, polydactyly is multiple digits, polymelia is multiple limbs. Skin diseases. Doesn't matter what the species is, exotic or domestic hoofstock, when you see this kind of alopecia, clumping of hairs, you want to be thinking about dermatophilosis, and that's what this is. These are the legs of Dall sheep. You notice the excoriation and hemorrhage obviously must have been a very paritic condition. In this case, it's chorioptic mange. Psorioptic mange can also be very paritic, in fact, maybe even more paritic than chorioptic mange. The only way I know of to distinguish the two is to have the mites identified. In this case, it was Chorioptes ovis. So when you have really severe paritic lesions on the legs of exotic sheep, think of the same kind of things you would in a domestic sheep. Oh, this was a really neat case. This is a subcutaneous mass lesion in a red ruffed lemur. It may be hard for you to pick out the exact nature of the lesion, but there are very small translucent cysts all through here. And these are cestode cysts. This is Tinea crassyceps. What you need to know about this is that the fox is the definitive host. There's a lot of different potential intermediate hosts. The fox picks this up by eating these cyst stages. Now, the reason why you need to know something about the life cycle is if you diagnose this ante-mortem, as we did, the first reaction you're going to get from your zookeepers is, I don't want to work with that animal anymore because I don't want to pick up this infection. You need to be aware this stage is not infective for humans. This stage is infective for the definitive host, the fox. What's infective for us are the cestode ova passed in the feces of the fox. So what you have to do is reassure the keepers they have nothing to worry about, then go grab all your gardeners and warn them that there's fox feces in the bushes around the lemur enclosure, and they need to be on the alert for that because we can be intermediate hosts for this parasite. So this is Tinea crassyceps, subcutaneous mass in a red ruffed lemur. This is a cheetah with an ulcerative conjunctivitis and dermatitis on the face. This is a feline herpes virus infection. We don't know why some cheetahs have a problem clearing this. We've seen in a few cases now this occurs in females postpartum. They can transmit it to their kittens by licking, and it's a very frustrating problem because you can treat them with antiviral drugs and it doesn't seem to help. For some reason, some cheetahs just have a real problem clearing a feline herpes virus dermatitis. This is a Siberian mink. You're looking at the foot pads. If you're preparing for the board exam, when you see the foot pads of an animal with a lesion like this, you ought to be thinking about canine distemper. In this case, it was vaccine-induced distemper. We had used a vaccine in these mink that we had used widely in mustelids with no problems, but for some reason Siberian mink don't seem to handle it well, and we lost the animals to a vaccine-induced distemper. And the lesion here is hyperkeratosis and ulceration and inflammation on the foot pads. This is the trunk from an African elephant. What I want you to see is the ulcerative lesions on the trunk. This is really an incidental finding. We see it in live animals. We see it incidentally in necropsy cases, and we haven't been able to sort out the cause yet. The only reason why I'm showing it to you is because it gives me a platform to talk about the elephant herpes viruses. Laura Richmond and Dick Montali have done some great work on this, and the short version of their results is it appears that African elephants and Asian elephants each have their own host-adapted herpes viruses, and if you bring those two species together in captivity, those viruses can cross species lines and cause fatal disease outbreaks in the other species, especially in youngsters. So most of the cases lately have been young Asian elephants who pick up the African elephant herpes virus and get a fatal infection. It's an endotheliotropic virus, so you'll see petechial hemorrhages, pericardial effusions, cyanosis of the tongue, things like that. So to get back to our case here, we've considered the possibility that these are herpetic lesions, but have never been able to get a good sample of one to test that hypothesis. So at this point, it's an idiopathic ulcerative dermatitis, happens particularly on the trunk. We're going to be doing more work on it. Maybe someday we'll be able to tell you what the cause is. This is a brush-tailed possum, and one of the few neoplasms I'll be showing you is this cutaneous lymphoma. And again, it goes along with marsupial disease syndromes, tends to be opportunistic infections and lymphomas. So kind of things you'd expect to see with immunosuppressive retroviruses. We suspect retroviruses are involved in some of these, especially in the koala, but in many of them, they've never really been investigated. So this is cutaneous lymphoma in a brush-tailed possum. Also remember, Australian possums, there's no O at the beginning of the word. It's just P-O-S-S-U-M, possum. North American is opossum, completely different taxonomic groups. Try to keep your opossums and possums straight. This is that ulcerative dermatitis I was telling you about in black rhinos. Can be very severe. They slough large pieces of skin and require long-term antibiotics to prevent secondary bacterial infections. We still don't know the cause of this, but a lot of good people are working on it. Fortunately, it doesn't seem to be as common now as it used to be. Hopefully it's on the way out, but still a very serious problem in the captive black rhino population. This is a pretty interesting lesion. We've laid back the skin on a feather-tailed glider, small mammal. This is a Trovan identification chip, and surrounding it is a very thick fibrous reaction, and this is a spindle cell sarcoma, we think induced by the Trovan identification chip. And we've seen maybe half a dozen cases of this in various small mammals. Still a very useful tool for identifying animals and planting these chips in the back, but every once in a while you can get a neoplastic response to the chip. This is the tail of a young dwarf mongoose. You ought to be thinking about the same kind of things you would think about in a young rodent. This is ringtail dermatitis, necrosis of the distal tail tip. We presume the same kind of environmental conditions predisposed to this in our collection animals. Low humidity, tends to be younger animals, probably complex pathogenesis, but just to be aware, same kind of thing can happen in exotic animals as happens in domestics. This is a really neat lesion. This is the back of a tapir. You're looking at the skin of a tapir. We had tapir keepers saying for a long time that every once in a while tapirs would sweat blood, and I never believed it. I thought it must be porphyrin in the sweat or something like that. But we finally got some really good biopsies of early lesions of this, and it's a vesicular dermatitis, and this really is blood. The blood just diffuses right through the epidermis and comes out on the surface. We have no idea what the cause of this is. Some epidemiology work is being done, but at this point, it's a non-fatal idiopathic vesicular skin condition that affects captive tapirs. So tapir vesicular skin disease. And this is a young Chilean poodoo. Thing to notice is massive edema around the head. If you slice through that skin, it's all serosanguinous gelatinous exudate around the head. Two differentials. One is massive trauma. Somebody kicked it in the head in a large mixed species enclosure, or in this case, a rattlesnake bite. Animals stick their noses down in the grass to graze, and if there's a snake there, they can get bitten on the nose. Unfortunately, sometimes with fatal consequences. Moving on to birds. This is a giveaway slide. You see a proliferative lesion in the oral cavity or anywhere on the skin of a bird. You got to be thinking pox, and that's what this is, avian pox virus infection. Birds usually die from this either because they can't eat, they can't see, or they get a bacterial septicemia as a result of the ulcerative skin lesions. Another example of necrotizing oral lesion. This is a barn owl. The slide is courtesy of Dr. Brian Stacy. And what you want to have on your differential, especially in a raptor, the top pick is trichomoniasis. It's a flagellate. They pick it up from their prey items, pigeons and whatnot, and causes a necrotizing stomatitis. Other things to have on your differential include capillariasis, candidiasis, and maybe even mycotoxins and some things like that. Avian pox can also cause that. In fact, here's an example of avian pox that's spread all the way through the crop of a young Andean condor. All these nodules that you see are pox virus lesions in this Andean condor. More typical proliferative ingluvitis. This is crop from a dove, thickened crop. In this case, it's capillaria. This is proventriculus and gizzard from another pigeon, and this is the lesion right here, Tetrameres. It's a nematode, lives in the proventricular glands. Usually doesn't cause major problems, but sometimes can set up significant secondary bacterial infections. So just be aware, dark lesions like this in the wall of the proventriculus, you want to be thinking about Tetrameres. This is a slide courtesy of Dr. Linda Lowenstein. This is cytosine with a massively distended proventriculus and gizzard, and this is proventricular dilatation syndrome. Cause of this is not completely worked out, but it's generally accepted to be a virus. The condition can be transmitted apparently with an 80 nanometer enveloped virus, but nobody's ever been able to completely characterize it. One thing to be aware of is there's lots of other causes of proventricular and ventricular dilatation in birds. The way you diagnose this is by finding non-suppurative ganglioneuritis in the wall of the organ. If you don't find that, don't make the diagnosis. In fact, this condition is extremely rare in zoo birds. It's mostly seen in the pet bird population. So don't cause trouble for a zoo you're consulting for by diagnosing this just based on the gross appearance. You got to do the histopath. Proventricular dilatation syndrome and acetylene. Here's another cause of dilatation in the upper GI tract. This is dilated crop in a hand-reared Pesquet's parrot. Main reason I show it to you is so that you're aware that diet consistency and feeding frequency can greatly affect the function of the crop in the upper GI tract. If you don't get those things just right, you can get crop stasis and get a big crop impaction like you see here. Gizzard from a California condor. Lead shot in the gizzard. Lead toxicity is a big problem in the California condors we released back into the wild. Main reason I show this to you is so that you know you have to have the lead shot in the GI tract in order to get lead toxicity. If a bird has been shot and it's got a piece of lead embedded in the muscle, they don't develop lead toxicity from that. You only get it by having lead shot in the GI tract where the lead can be absorbed. This is a really interesting case that not many people know about this problem. This is a Nicobar pigeon. This is esophagus up here, proventriculus, and gizzard. What's unusual about Nicobar pigeons is they have coilin cups in their gizzard. Coilin is the waxy lining of the gizzard. On both sides of the gizzard, there are cup-shaped depressions in the coilin where a large, smooth, flat rock is held. And the rock is so big that sometimes veterinarians confuse it for a foreign body on an X-ray, and they'll go in endoscopically and remove the rock. If the rock is removed and the bird doesn't have an opportunity to replace it, the coilin can overgrow and form a large mass like you see here. This is coilin cup overgrowth in a Nicobar pigeon, and that can occlude the gizzard, and basically the bird can starve to death because the gizzard is occluded by a big coilin mass. So be aware that Nicobar pigeons have this unusual gizzard anatomy. If you find a large, smooth, flat stone in there in a live bird, tell the clinical vets not to remove it. It's something they need. Moving down to the intestine, when you see sort of nodular lesions in the wall of the intestine of a bird, first thing on your differential is Mycobacterium avium. Certainly some parasites and other things could be on your differential, but number one is Mycobacterium avium, largely an intestinal disease in birds. Ulcerative and necrotizing enteritis in a quail. First thing on your differential is Clostridium calinum. Can also occur in other gallinaceous birds, and because carriers can develop and contribute to annual outbreaks, you want to stay on top of the management of this as soon as you identify it. So this is Clostridium calinum, ulcerative enteritis in a quail. This is a lorikeet, nectar-feeding bird, dark red intestines. Number one thing on your differential is Clostridium perfringens. Most of these turn out to be type A. The problem is nectar is a big part of their diet. Nectar is very high in carbohydrates. Clostridia like those kind of high carbohydrate environments to proliferate in. So they tend to be predisposed to this. Anything that throws off their gut motility or a change in diet can contribute to this condition. Just be aware nectar-feeding birds have a problem with Clostridium perfringens enteritis. This is small intestine from a dove from a large multi-species exhibit. This is about the only place we see this problem. This is an ascarid impaction. The reason why we only see it in large multi-species exhibits is because in large aviaries we can't catch these birds to treat them. So condition goes on for a long time. Rarely, if a bird has some other problem, the parasites can get out of control and cause an impaction like you see here. So ascarid impaction in a pigeon. This is necrotizing typhlitis in a gallinaceous bird. Any kind of gallinaceous bird with these long cecae can develop this condition. This is histomoniasis. Remember, the nifty life cycle of this parasite is the infective stages of the protozoa are incorporated into the eggs of the heterachous nematode. Then they're passed out in the feces, an earthworm eats the egg, the bird eats the earthworm, and the life cycle is completed. The protozoa can then penetrate the wall of the cecum and set up these really severe necrotizing lesions. You can also see lesions in the liver. They look like little bullseyes. So histomoniasis in a gallinaceous bird in a zoo. This is a young columbiform, a young pigeon with a seed impaction. Thing to know about this is there are some columbiforms that only eat fruit. When we try to foster rear those fruit-eating pigeons and doves under other species of pigeons and doves that have a mixed diet, we have to make sure we remove all the seeds, because otherwise the parents will pack the chicks with seeds. They're not used to a diet like that. They can't digest it and absorb it. So this is a seed impaction in a fruit-eating dove due to a dietary mistake in the foster rearing parents. Keepers had neglected to remove some seed as they started the foster rearing process. This is I'm including this in the GI section, but this is really a reproductive disease. This is a prolapsed cloaca in a psittacine. Egg binding is the major predisposing factor. Females trying to lay an egg, they can't get it out, they strain too hard and prolapse the cloaca. So this is cloacal prolapse. You also want to be thinking about cloacal polyps. Anything that can cause a cloacitis can contribute to this, but mostly it's a reproductive problem in females. Moving on to some liver diseases. Should have a good differential for white spots in the liver. M. avium would be a top choice, but when you've got a fibrinous coelomitis going along with it, think of other pathogens. In this case, it's Yersinia pseudotuberculosis. So not a common condition, but a great cause of white spots in the liver with accompanying fibrinous coelomitis in birds. This is classic. This is M. avium. When you see these multifocal to coalescing white spots in the liver without accompanying fibrinous change or something to indicate it's more acute, think Mycobacterium avium. This is an interesting thing we've seen in shell ducks. This is liver. On the cross section you see all of these cavitations and cysts. Now it may look like a neoplasia. In fact, I've known pathologists who have diagnosed this as a biliary cystadenocarcinoma and never even bothered to look at the slides. Turns out this is a Mycobacterium avium infection. We don't know why it causes this cystic change. Very often there's amyloid accompanying the inflammation, but be aware that mycobacterial infections and shell ducts can create these cystic lesions in the liver. This is liver from a bird of paradise. You have to know something about the species that are susceptible to hemosiderosis and hemochromatosis maybe to get this, but when you see bird of paradise and a liver like this, think hemochromatosis. And remember, the problem is not so much a primary iron overload in the diet, it's that the diet lacks the tannins and iron-binding compounds the birds would normally encounter in their environment, and that contributes to the problem. So dietary management has to include tannins and iron-binding compounds. This is liver from a tanager. You want to have a good differential diagnosis for hepatomegaly. Anything like bacterial septicemias, protozoal parasite infections, acute viral infections can all cause this. In this case, this is a Hemoproteus infection. You'll see sometimes in the literature it's stated that Hemoproteus is non-pathogenic. A lot of times it's not, but sometimes it can be. So this is fatal Hemoproteus infection in a tanager. So this is a duck with an enlarged liver. The tip-off in this case is the pale color of the intestines and the dark color of the liver. This is a Plasmodium species infection, avian malaria in a duck. Tip-off, again, is the pigment. If you examine that liver under a microscope, the pigment is birefringent, so use your polarizer. This is a good slide because there's, again, two things going on. The easy thing to get is the capsular gout on the surface of the liver, but the other thing is massive hepatomegaly. The liver should extend just a little bit past the keel in a bird like this, and you can see it extends several centimeters past the keel. So this is a falcon adenovirus infection. We've done a fair bit of work on this now in collaboration with Dr. Lindsay Oakes at Washington State University. And this, based on our work, we think this is a unique adenovirus. It doesn't occur in domestic birds. And evidence so far suggests that peregrine falcons may be a normal carrier host. They don't seem to have as much of a problem as other falcons. So if you bring peregrine falcons in contact with other species of falcons in captivity, you can get fatal outbreaks of this falcon adenovirus. So this is falcon adenovirus in an Aplomado falcon. Now here's a good one because the main thing you're going to clue in on is really a distraction. These hemorrhages in the pancreas can be seen occasionally in this condition, but the more common problem is down here. Hemorrhagic inflammation in the cloaca. This is duck virus enteritis. Common sites of involvement are esophageal and proventricular junction and the cloaca, and sometimes you'll see annular bands of necrosis in the intestine where the lymphoid tissue is necrotic because of virus replication there. So be on the lookout for multiple lesions. This is an uncommon finding with duck virus enteritis. This is the more common finding, inflammation in the cloaca. This is a golden pheasant liver. Main thing to notice is the color, the patchy, the mottling, the dark green staining is bile accumulation. This is a chronic hepatopathy. We think it's due to mycotoxin exposure. You have all the classic lesions histologically, biliary fibrosis and hyperplasia and so forth. Now you might wonder, how does mycotoxicosis occur in a well-managed collection? Well, I can only speculate that in some of these enclosures what might happen is when the food is put out in a pan, the birds can scatter small bits of food around the enclosure, and the keepers can't always recover all of those little bits of food. If a piece of chopped apple falls under a bush and eventually gets moldy, a bird might still come along and eat that later, and we think that may be contributing to this. We mainly see this in ground-feeding birds, in this case a pheasant. So probable mycotoxicosis in a golden pheasant. This is a liver from a California condor. Thing to notice are these tan spots on the liver. And the real issue with California condors is they've got a lot of really nasty anaerobes in their gut. All vultures do. And post-mortem, those organisms can ascend the portal tract into the liver, and this is actually just an autolytic change. So be aware that autolysis can create some unusual patterns in the livers of vultures and other carrion-feeding birds. This is yolk sac from a kiwi. What I want you to notice are the areas of hemorrhage along here. There's also dark red intestine. This is enteritis and a yolk sac infection in this bird. 3 ways chicks can pick up yolk sac infections. One is if there's bacteria in the oviduct when the egg is being formed, the bacteria can be incorporated into the egg. Right after an egg is laid, as the egg cools, air is drawn in through pores in the shell, and bacteria can penetrate those pores at that time. And the third way is when a chick is hatching, it breaks through the shell, sometimes before the yolk sac is completely retracted, and bacteria can get in at that time. So 3 different ways yolk sac infections can develop. You need to try to sort those out because managing them requires different types of intervention. This is an interesting case because it reminds me to tell you that everybody knows birds have pneumatic spaces in their bones. What a lot of people don't realize is most of those pneumatic bones retain a connection to an air space, either a sinus or an air sac. In this case, in the skull, those pneumatic spaces connect to paranasal sinuses. And if those sinuses get occluded, then you can get bacterial and fungal infections in them. In this case, there's a combination candida and bacterial infection secondary to a vitamin A deficiency that resulted in epithelial dysplasia and occluding of the outflow tracts of these pneumatic bones, and so you've got an infection settling into the bones of the skull. This is a Gouldian finch. Trachea has little dark spots on it. Those are tracheal mites, typically incidental. Just be aware that they exist. You need to be very familiar with all the different manifestations of aspergillosis. If you're lucky, you'll have green fuzzy growth that's readily identified in an airway here. But very often, you won't see that fuzzy growth. Sometimes you'll just see yellow plaques. You got to be familiar with it in all its manifestations. This is an aspergillus plug in the bronchus of a bird. You can see it's formed a cast running right down the airway. It's just a mat of fibrin and fungal hyphae and inflammatory exudate. You can also see occlusion of the trachea with a small aspergillus plug right at the bifurcation of the trachea. Birds can die of asphyxiation very easily with just a very, very small aspergillus plug in the trachea. Here's a more typical, very nasty aspergillus air sacculitis in a bird. Now, I've been showing you enlarged livers, and this bird certainly has an enlarged liver, but we're on respiratory tract right now. What I want you to notice is the lung is edematous and kind of off color. Instead of being a nice bright pink, it's more of a dull pink purple. And that's a tip-off. This bird has a Sarcocystis infection. Most of the cases we see are Sarcocystis falcatula. The definitive host is the opossum. The control mechanism is make sure you don't allow possums to get on top of bird enclosures at night because they'll defecate into them, contaminate the enclosure. If the birds get a whopping dose of the oocysts, the first replication stage in the bird is in the capillary endothelial cells of the lung. If too many capillaries are infected, it causes massive pulmonary edema and the birds will die of respiratory failure. So sarcocystosis in a bird. For renal lesions, we don't really see that much in birds other than gout. In this case, there's massive sludging of urates in the ureter, so it's easy to pick up. In other cases, you just have to look for very fine speckling in the liver or in the kidney, as you see here. Sometimes the color of the kidney may be normal, but there's just little tiny cream-colored flecks in the kidney, and that's renal gout. You can also see visceral gout as the primary indicator that the kidneys are failing. So be on the lookout for that as well, visceral gout. For reproductive tract diseases, remember the follicles that develop in a bird are large and fragile and have a rich vascular supply in the ovary there. If those are ruptured traumatically, a bird can bleed out, but you can also get a bacterial infection in the ovary or the oviduct that can do the same thing. And this is a large blood clot from an E. coli infection in the ovary that ruptured through a blood vessel. So E. coli oophoritis in a bird. This is a more chronic condition, chronic salpingitis in a bird, retained unshelled egg in the oviduct. All of this yolk is being resorbed. This is all laminated fibrin and inflammatory debris. The yolk itself, when it's retained in the oviduct, doesn't cause a problem, but it's a great environment for bacteria to proliferate. So that's where the problem arises. Bacteria get in there and set up this infectious process. I mentioned earlier the cloacal prolapses that result from egg binding. In this case, the birds prolapse just about everything. The cloaca is all out here, and this is the oviduct that's prolapsed as well. So again, egg binding, primary problem in these cases. This is a California condor embryo that died during the pipping stages, the hatching stages. What you need to know is that birds in the egg have to be in a proper position to hatch, just like mammals have to be in a proper position in the birth canal in order to be born. In birds, the normal position is head under the right wing. In this case, the bird's head is under the left wing, and that makes it harder for it to reach up into the air cell because now it's got to get up to the upper slope of the air cell. Sometimes it doesn't make it, and the bird will die of suffocation in the late stages of incubation here. So this is a malposition in a California condor. This is a poor umbilical seal. Remember I mentioned that one of the three ways that yolk sac infections can develop is by bacteria penetrating the yolk or the seal right around the time of hatch. In this case, there's strands of fetal membrane sticking out of the umbilicus, and that's a perfect avenue for bacteria to penetrate. You might also notice that there's some other problems in this condor. The head is massively edematous, and the legs are just these little stubs down here. This is chondrodysplastic dwarf. It's a lethal condition that occurs in the California condor population. It's hereditary. We're working on a genetic test so we can identify carriers and better manage the captive population. But the main thing here I wanted you to see